Last year at this time, governments around the world intensified efforts to contain a deadly flu virus that killed scores of people in Mexico and quickly spread around the world. Late last April, World Health Organization Director General Margaret Chan warned that a pandemic was imminent and that the time to prepare for it was short.
Certain actions now should be undertaken with increased urgency and at an accelerated pace.
It was the first flu pandemic in more than 4 decades.
There was a lot about this new virus that we didn't know.
Dr. Stephen Redd headed the H1N1 flu response at the U.S. Centers for Disease Control. Health officials did not know how deadly the virus would be, who would be the most vulnerable, how quickly it would spread, and whether it could be contained.
In the early days, the first few cases in the U.S. had actually recovered by the time they had been diagnosed, but the information that we had from Mexico, the first cases were all from people who had died.
Health officials had been preparing for a flu epidemic for years, but viruses do not follow a plan.
In our pre-pandemic work, we were really focusing on the avian influenza, mostly in Asia and Africa, and so the assumption that the next pandemic would start overseas or far from the U.S. turned out not to be true.
Dr. Redd said one of the things health officials learned is that the global surveillance system needs to be even more comprehensive. He says communication was a major factor in containing the virus.
Keeping everybody up to speed with what was happening, what we were doing, what we were learning, what we thought the key issues were, that was extremely important.
Even high-level officials demonstrated ways to prevent the flu from spreading.
Washing your hands, coughing into your sleeve.
Throwaway tissues that you sneeze into.
Flu vaccines are not difficult to produce, but the drug companies found this virus difficult to grow. Dr. Anthony Fauci with the National Institutes of Health expressed frustration with the slowness of the process.
You really can't do anything when you have a virus that's not growing well except trying to wiggle it around to get it to grow better.
Many experts say there has to be a better way to produce vaccines. Stephen Morrison is an authority on global health policy at a Washington research center.
And the production of vaccine remains highly uncertain and highly antiquated.
Morrison says better technologies need to be developed to speed up production.
Lecture on.
Demand drew scores of people to vaccination clinics in the U.S., but there was no plan for distributing a pandemic-level vaccine in the U.S. or anywhere.
1, 2, 3.
The new virus led to patterns of death and illness not normally seen in influenza infections.
In a normal flu season, 90% of the deaths occur in people over 65. In this outbreak, close to 90% occurred in people under 65.
In 2009, the H1N1 virus killed more than 16,000 people worldwide. Some critics say the World Health Organization overstated the impact of H1N1, that it was really a mild pandemic. Dr. Redd disagrees.
So it really had a tremendous impact on children, young adults, and adults with chronic medical conditions. So I think it would be a mistake to characterize this pandemic as being mild.
Dr. Redd says H1N1 is still a threat, and he expects it to be the dominant flu virus in the Southern Hemisphere in this coming flu season. Carol Pearson, VOA News.
It's easy, huh?